Johnson, and today, because the month of November is Thanksgiving, we are actually having a Thanksgiving month for our patients so they can bring their family members in and get a free chiropractic examination just for being in the family. And that's how we're showing our patients thanks for seeing us and believing in us and getting well and referring their family and friends. So we're going to do an examination today on Anthony, who has absolutely no pain whatsoever, and I'm going to show you how we do find problems in people even if they don't have pain. So let's go ahead and face the mirror for me there, Anthony. And what I'm going to have you do is close your eyes and bend your head forward all the way and backward all the way, like you're looking at the ceiling, but keep your eyes closed. And now back to normal. Okay, now take a nice deep breath in and let it all the way out and just relax. Very good. Now his posture is not too far off actually. He's got a little bit of translation to the right on his neck and head, and his left shoulder is just a tad higher. If you look down here though, you'll see his pelvis has translated to the right of center. It's a little closer to this hand than it is over here on the left on this side. And from the side view, his head is a little bit forward, but his head's not forward flexed, so that's good. And his hands are a little bit out in front of him here because it's starting to get a little bit of rounding on his shoulders from a little of that forward head posture. Now, when you bent your head forward like this, Anthony, did you feel it pulling right through here a little bit?
Yes, sir.
Okay, and how about when you go backwards all the way? Does that kink up a little right there?
Yes, sir.
Yeah, that's what I thought. Okay, now let's have you lay on your back right here for me, please. Feet down there and head up here. This is a standard exam that we will do on our patients to determine whether they have problems or not. This is called a straight leg raise test, and we just lock the leg straight. Now you're going to get a hamstring stretch right here. Is there any pain in your leg or your back when I do that? Just the tightness there, but no other shooting pain? Okay, it feels better right there?
Yeah, it feels better.
Is there any pain in your back or leg when I do that?
No, sir.
Okay, good. Okay, so that was called a straight leg raise test, and then Braggart's test. Now I'm going to push straight down. Hold this for me. Hold it up in the air. Okay, this is testing his psoas muscle and his pelvis, and that was good on the right. Just relax that. Now I'm going to let that flop down here, and I'm going to push down here, and you tell me if you have any pain in your pelvis right here when I do this.
Yes, I got something.
Just stretching, or is there any pain?
Stretching.
Okay. That is called a Chiropractic test. It tests for hip problems. Now, we're going to have you there, and is there any pain in your back or leg there? Straight leg raise test on the left, right. We drop that leg down, and we do this. This is called a Braggart's. Any pain in your back or leg there?
No, sir.
Okay, good, and let's relax that here. And how about when we do this one? Is there any pain in that hip joint or pelvis?
No, sir.
Okay, good. Now, I'm going to push this leg straight down. Hold it up. Very good. Now, he's got strong muscles in his psoas muscles here and his pelvis. Plus, he has a normal straight leg raise test, and a Chiropractic's is negative on both sides. Next one I'm going to do is lift his head up. Let's go like this. Is there any pain in your back or neck anywhere?
No, sir.
Okay, good. Okay, now push against my hand. Backwards. Good. Now push forward. Good. Now tilt sideways. Good. Now tilt sideways. Good. Now turn sideways towards me and turn it towards me. Good. Now I was doing muscle tests on his cervical spine muscles, so we make sure that we get all the passive range of motion and muscle testing out of the way there. Now, what I'm going to have him do is sit up and face that way for me. There we go. Now we're going to check for any cervical intervertebral foraminal encroachment with this, so I'm going to do a maximum foramina compression test straight down. Is there any pain anywhere in your spine?
No, sir.
Now, we're going to do this on the right by turning the head and rotating it and pushing down obliquely. Is there any pain in your neck there?
No, sir.
Okay, and we're going to go back and left here. Is there any pain in your neck or shoulder there?
No, sir.
Good. Okay, now tilt your head to the right. And you can see his range of motion there is a little bit limited. Does this cause tightness in your neck right here? Okay, this is a shoulder depressor test. The test that I just finished pushing down was a maximum foramina compression test, and that was negative bilaterally, so that means he's not pinching the nerves here. Now we're going to tilt to the left, or you can go. Yeah, he's got a little bit of a restricted range of motion on that. Is there any pain at all in that?
No, sir.
Okay, good. Now let's turn your head left. Very good. Now turn your head right. He's got more of a range of motion to the right than he does the left. So you can go ahead and go left again. Did it feel easier going to the left than it does to the right? Go to the right now.
Feels easier to the right.
It feels easier that way. Okay, good. Now let's have you come over here on this table. Actually, just sit right there for 1 second. I'm going to do your reflexes. We're going to check his biceps. There you go. And just relax your arm in one hand, just lay it flat. His brachioradialis right there. And his triceps, just let that hang right here. Right there. And then same thing over here, just relax this whole arm for me. There you go. That's the biceps, that's fine, +2. That's the brachioradialis, and there's the triceps, and you can relax those. And just relax here. Now he's got a good +2 equal reflexes symmetrically from left to right in his patella. Okay, relax your foot. There you go. Good. Good ankle reflex there. That's the Achilles reflex is normal on both sides. Just a few more things. I'm going to do a muscle test straight down. Hold real hard. Push. There you go. And I'm going to do the same thing over here. Hold. Good. He's 5 by 5. He's great on a scale of 5, and he's very strong in that. Now I'm going to do biceps. I'm going to pull out. Hold. Excellent. Now I'm going to push in. Hold. Excellent. Now I'm going to pull out. Hold real hard. Excellent. Now I'm going to push in. Excellent. Very good. See, he's got good strength in all his upper body, and no positive orthopedic neurological tests so far. So let's have you come over here and lay prone on your stomach. There we go. And now I'm going to begin his spinal exam. We got a little place for your hands to rest right up here. There you go. Right there. So we're going to test Anthony's leg length first. And his legs are even exactly. And they stay even. Is there any pain or tightness in your lower back at all?
No, sir.
Okay, he didn't have any pain or tightness there, so he had a negative Knockles and a negative Deerfield. There was no change in the leg length. That was all good. Got a little bit of soreness right there, but not bad. A little tightness right here at L5. Do you ever get some low back pain right in here? Not much?
No.
Okay. Now see, he doesn't have any pain and has not had any pain, so we're doing an exam on a patient that has absolutely no complaints, but see, that's tender right there, I know. You feel that one?
Yes, sir.
Yeah, this is his mid-thoracic spine, about T5, and it's sunk down inside of the ribs there. And that's the only one I found in there so far. Do you ever get headaches at all?
No, sir.
Okay. Yeah, his neck's feeling pretty symmetrical too. A little bit right here on the lower right side, and a little bit of knots in his shoulders, which a lot of people have, stress, but right here in his upper back and mid back's the most stress that I see. We're going to lock this leg straight, and I want you to lift your whole right leg off the table. Nope, lock it straight, and lift the whole leg up. There you go. Good. Okay, now that one down, and we're going to put this one up. This is a sacral deviation test, and you put that back down. Now, his left one didn't come up as high as his right one, so that would explain a little of the imbalance that I see here in his sacroiliac joints. But he's not all that imbalanced in here anywhere, so that's really good. Very good. Let's go ahead and have you sit up for me, and I want to have you stand right here, and I want you to bend over like you're going to touch the floor for me. Tell me if you have any pain in your back anywhere.
No pain.
Okay, that's good. Now go backwards like this all the way. Is there any pain doing that?
No, sir.
Good. And now tilt left and right. Good. And now twist left and then right. Very good. Excellent. He has a normal examination, so the only way that I would take care of Anthony at this point in time is if he wanted to get preventative care prior to ever even having any back pain or conditions developed. So would you like to get an adjustment, just see how it makes you feel?
Yes, sir.
Okay, so let's have you go on your tummy. So this is going to be his first adjustment, and he has absolutely no pain, so we're going to adjust him and see how he feels after the adjustment compared to before. Because I've been doing this for 32 years now, and I would just about bet that he's even going to feel better after the adjustment than he did before the adjustment, and he didn't even have any pain. Do nice straight drops on L5 all the way through to L1 up here. And we're just going to do some real gentle mobile adjustments and track manipulation in the thoracic spine. I'm going to let your head down a little bit so we'll spread the joints out there. Just relax this for me. There we go. One more right here. There we go. And I'm going to do some lateral traction right here. Excellent. Now, we've also been asked and requested to do an exam for scoliosis on a patient, so I'm going to explain that right now. A scoliosis would be a lateral curve of the spine. If he had a spine that's supposed to be straight, only his spine was curved, that would be called a scoliosis. If it has a lateral curve in the spine, because it's supposed to be straight from the front back view. Now from the side view, you have a curve forward in the neck, backward in the mid-back, and forward in the lower back, which is what he has. So if he was laying down here, he would be lined up pretty good without a scoliosis either. So his spine, his head sitting directly over his sacrum right here, and that's showing normal. So, and you can see my hands right straight down, so he doesn't have any curvature or scoliosis in there at all, which is excellent. But I am going to finish off his preventative adjustment or manipulation, show you exactly what we do just to open the joints up, get those moving. There we go. Excellent. Now let's have you roll on your back for me. And Anthony has a lot to be thankful for because his tests are all negative and he's doing pretty good. Same over here. That's it. Excellent. You notice there still is a popping noise, or what we call cavitation. That is where the carbon dioxide gas explodes inside the joint capsule. It's not an abnormal thing. Very good. Okay. Now, let's scoot you down on the table as far as you can go. There you go. Good. Now just lay back there, and I want you to put your arms out like this, and I'm just going to adjust your shoulders and your clavicles, which are your collarbones, and your chest on both sides. It should actually help you breathe better. Now let's sit you up sideways and face that way for me. There we go. Go ahead and just sit up though. There you go. Good. Now, we're going to just check his shoulders here. There's no grinding or crepitus or restriction in his right shoulder. Excellent. Still got movement there though. Look straight ahead again and just relax. And good movement there as well. And just check his elbows, his wrist, hands and fingers all the way through. Excellent. Excellent. I know you probably heard that one all the way over there too. Very good. All right. There, good. Now I want you just to stand up and walk around over here for me, Anthony, and let's stand in front of the mirror again. And the very last thing that we're going to do, like we do with every patient, is do the adjusting instrument on the x-axis on his atlas. We're going to retrain his brain to actually hold him in place, which he's in right now. So let's close your eyes and flex your head forward all the way. Very good. And now backward all the way. And see how much more range of motion he's got now even? Now neutral. Now you can see the difference in the range of motion that he had. It was pretty good before, but it was a lot better even afterwards. The only thing I would do with him is have him bring his shoulders up. You can open your eyes now. Up like this and hold his arms out like this. And we're going to bring his head straight back in the z-axis and adjust his atlas on the x-axis so that it sends neurological information into his cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement. So you can relax now. And let's do that very same thing one more time. Forward all the way. Yeah, very good. Backward all the way. And then neutral. Did that one feel smoother than the first one even? Very good. Okay, this is great posture. Thank you, Anthony, for participating in it, and be thankful that you don't have any serious spine conditions, so you're in good shape.
Yes, sir.
So you can just come in here and get adjusted on a preventative basis and keep it that way whenever you want to. And we want to thank his brother, who's done a great job, and he came in from watching YouTube videos, so he didn't want to really be in one, but he is anyway. So anyway, we're going to see you next time, and we'll talk about things that you put in the comments, so please let us know what you're thinking, and we'll see you next time. This is Dr. Gregory Johnson, your Houston chiropractor.